My name's Aliyah Sanchez, and today I'm going to be talking about the cycles approach. So the cycles approach is a phonological disorder treatment. So what is a phonological disorder? So a phonological disorder, if diagnosed, children find it difficult with a phonological disorder to produce speech sounds correctly, arrange speech sounds into patterns, or comprehend the laws governing language sound structure. So, what is the specific population that the cycles approach targets? So, the cycles approach is most effective in the age group of 6, 7, 8 years of age, and these children have to have multiple phonological processes going on to be eligible for the cycles approach, and they have to be diagnosed with a severe to profound phonological disorder. These children who are eligible for the cycles approach are usually almost always highly unintelligible and have more than two phonological processes going on. They also have a restricted or a little bit of consonants in their vocabulary to be eligible for the cycles approach. So how does the cycles approach actually work? So the cycles approach, like in the name, is a huge cycle. So, for example, a child walks in and is exhibiting many phonological processes. The SLP will begin on one phonological process, and depending on the severity, the SLP will choose time between 4 to 6 weeks and will work on one phonological process. Once the 4 to 6 weeks expires, then another phonological process will be targeted. Then once that time, 4 to 6 weeks passes, the SLP will then move on to another phonological process, all in a cycle. Once all phonological processes that the child is exhibiting have been targeted once, the SLP will then go back to the first phonological process when treatment began. With this style of treatment, it shows that the cycles approach focuses on eliminating affected sound classes and errors or patterns, which leads after treatment to generalization across impacted phonemes or phonological processes. The main basis for this treatment is that it mirrors typical phonological development, which makes this treatment effective. The cycles approach also does target phonological processes that occur 40% of the time, but with the exception of nasals and glides, which must be present 60% of the time. Some more details on treatment include how treatment targets specific categories. So in the cycles approach, there are 3 categories. So the first category would be the primary targets, which would be phonological processes. A secondary target, which would be or address intelligibility, voicing, vowel errors, and articulation errors. And the third target would be advanced targets, which would include vowel harmony and word stress pattern. So of course, during treatment, we would touch the primary, secondary, and advanced. So just to recap, the cycles approach is most effective in older age children around the ages of 6, 7, 8 years. These children must be diagnosed with a severe to profound phonological disorder and must exhibit multiple phonological processes going on in order to be eligible for the cycles approach. In this specific population, it's proven most effective and results do show in this population. And that's it for my treatment presentation. Thank you for listening.